about the Mayo Clinic being able to provide quality service, quality preventive care at reasonable costs in a fairly large metropolitan area. And then you hear of rural areas where there is one hospital, people have no choice about where they can go. And I want to know how you can reconcile those two things for the general public.
I'm not a absolute expert on the Mayo Clinic's model, but I've looked at it fairly carefully, but I haven't personally gone back and seen it. What the Mayo Clinic has done and what other parts of the country have done that are holding healthcare costs down is they put their emphasis on preventative and primary care. If you go to another country in the world, you'll find about 30% of the physicians and providers are in specialty care, and about 70% are in primary preventative care. And that's the big reason that they have better outcomes and lower costs. And the Mayo Clinic, the Cleveland Clinic, and a couple others have accepted that model. And their ratio of providers as far as primary and preventative care to specialty care is closer to what's happening overseas. And so it's not so much a matter of what your location is as what your model is. And surprisingly, if you go to a lot of rural areas where you have a single hospital, you'll find the costs are actually lower. The lowest cost for healthcare in Oregon right now is in Eastern Oregon, where they have two major hospitals, one in Bend and one in Ontario, and a huge number of primary care physicians compared to specialty care. And the cost over there are actually lower, and the outcomes, as we are measuring them right now anyway, appear to be as good as or better than other parts of the state. So it's really the model, not the location. I hope I've answered that for you.